In this video, we are diving into the blood supply of the kidney and the two main types of nephrons you must understand. Remember, the kidney has two main regions: the cortex, which is the outer layer, and the medulla, the inner core made up of pyramids. As mentioned in our previous videos, each renal lobe includes a medullary pyramid plus the cortex above it. And within that, we have renal lobules, which is a cluster of nephrons draining into one collecting duct. Now let's zoom in on how blood flows through all of this. The kidney's blood supply begins with the renal artery, which branches straight off the abdominal aorta, a big highway of blood. This renal artery splits into segmental arteries, the main branches that actually enters the kidney. Next stop, the interlobar arteries. They travel between the medullary pyramids, heading towards the border between the cortex and the medulla. There, they curve around and become the arcuate arteries, like little arches around the top of the pyramids. Then come the interlobular arteries, shooting up into the cortex. From these, tiny afferent arterioles branch off, and those are vessels that feed into the glomerulus of each nephron. Now here's where it gets really interesting. After blood is filtered through the glomerulus, it exits through the efferent arteriole, and what happens next depends on the type of the nephron. In cortical nephrons, the efferent arteriole gives rise to the peritubular capillaries. These capillaries wrap around the tubules and play a key role in tubular reabsorption, where filtrated substances like glucose, water, and electrolytes return back to the bloodstream, and tubular secretion, where certain waste products are added to the tubule from the blood. But in juxtamedullary nephrons, things go deeper, literally. The efferent arteriole forms long straight capillaries called the vasa recta, which dive deep into the medulla. These vessels are crucial for concentrating urine. After all this, the blood begins its return journey through interlobular veins to arcuate veins to interlobar veins, then into segmental veins, and finally the renal vein, which exits the kidney and rejoins circulation through the inferior vena cava. Alright, now let's break down the two types of nephrons. Cortical nephrons, and they make up about 85% of all nephrons, located in the outer cortex, and they have short loop of Henle. Cortical nephrons are surrounded by peritubular capillaries, and they are more involved in basic filtration and reabsorption. The other type is the juxtamedullary nephrons, and the juxtamedullary nephrons make about 15% of the total number of nephrons found at the junction between the cortex and the medulla. They have long loops of Henle that go deep into the medulla. Juxtamedullary nephrons are surrounded by vasa recta, and they are essential for urine concentration. And that wraps up our tour in the kidney's blood supply and the two types of nephrons. In the next video, we will move into the magic of urine formation, starting with the glomerular filtration membrane. If this helped you understand the kidney better, go ahead and like, subscribe, and share with your med friends. Thanks for watching, and I will see you in the next one.